Today we will be discussing insights from a qualitative study, which was the reading on the role of school culture in supporting student mental health, particularly in the wake of the COVID-19 pandemic. And this study was conducted in two comprehensive secondary schools in London. It highlights key factors within school culture that either help or hinder student mental health and how schools can improve their environments to better support both students and staff. We'll explore the findings, focusing on the interplay between school culture, leadership, and mental health, and discuss the challenges schools face in trying to provide consistent mental health support. The backdrop for this study is the concerning rise in mental health issues among children and young people, which has worsened significantly since the COVID-19 pandemic. Between April and June 2021, referrals for mental health services for young people jumped by 134%. Referrals for urgent emergency crisis care also increased by 80% from the previous year. Despite this growing mental health crisis, many schools continue to lack consistent and adequate mental health support systems. Schools are well positioned to provide a supportive environment, yet the level of mental health provision varies widely across institutions. And so the study that we read aims to explore how school culture can influence mental health and what can be done to support the growing needs of students. The research focused on understanding how school culture can support or hinder student mental health, especially as schools were transitioning back to in person learning after pandemic lockdowns. The study used in depth interviews with school staff and parents, focus groups with students, and analysis of school documents. The study was conducted in two comprehensive schools in London, each with its unique environment and student demographics. One was an academy known for academic excellence, and the other was a faith based school with a high number of refugee students. This allowed the researchers to examine how different school cultures impact mental health support. One of the key findings from the study is the inseparable link between mental health and academic achievement. Both students and staff emphasize that addressing mental health issues is essential for academic success. However, the level of mental health support varies greatly between schools. There are also challenges in identifying mental health issues in students. Often, symptoms manifest in ways that teachers might not immediately recognize, such as disruptive behavior rather than obvious signs of distress. The pandemic has further complicated this, with many students struggling to readjust to the school environment. An important insight is that the mental health of teachers is closely tied to that of students. Schools that focus solely on student well being without supporting staff may find it difficult to maintain a healthy overall school culture. The study found that a school culture that promotes respect, diversity, and inclusivity is vital for positive mental health outcomes. And the school studied fostering a sense of belonging and ensuring that students felt supported was critical to their emotional well being. This includes having clear anti bullying policies and creating safe spaces where students can seek informal support. However, this may not always be easy to achieve. One of the schools had an intense academic focus, which created pressure for students to perform at a high level. While this may benefit academically inclined students, it can cause stress for others who struggle with these expectations. Balancing academic rigor with social and emotional support is crucial for maintaining a healthy school environment. Trust between students and teachers was another key element. Students were more likely to confide in teachers they trusted, and relationships often strengthened over time. Schools with high staff turnover face challenges in maintaining this continuity. The quote unquote whole school approach involves embedding mental health and well being into every aspect of the school environment. It's not enough for mental health support to be peripheral or seen as an add on. It must be part of the fabric of school culture. One way schools can achieve this is through social and emotional learning programs. These programs teach students essential skills like self awareness, self regulation, and resilience. Studies have consistently shown that SEL programs, especially those implemented early, can lead to better mental health outcomes and improved academic achievement. The study we read also emphasized the importance of involving students in shaping their school environment. When students feel that their voices are heard, it fosters a sense of belonging and trust, which are key elements in promoting mental health. One of the study's major findings is the inconsistency in mental health services across schools. While some schools offer comprehensive support, others provide only minimal resources, which can leave students without adequate help. Another issue is the challenge of identifying mental health problems in students, particularly when these problems are expressed as behavioral issues. For instance, boys are more likely to exhibit disruptive behavior, which can be misinterpreted as, as a discipline issue rather than a mental health concern. This highlights the need for better training for staff to recognize these subtle signs. Finally, the absence of formal mental health policies in many schools creates significant gaps in provision. Schools need clear, structured policies to ensure that mental health is prioritized and properly supported. Leadership plays a critical role in shaping school culture and mental health support. In the two case study schools, there were clear differences in leadership styles and their impact on the school environment. One school had a strong top down leadership style, which was effective in promoting academic success, but sometimes led to a more authoritarian environment. This created stress for both students and staff. In contrast, the other school had a more open and transparent leadership style, which promoted trust and collaboration. Staff and students felt more comfortable raising concerns, and the school made an effort to balance academic expectations with emotional and social development. Leadership that prioritizes well being alongside academic achievement creates a healthier and more supportive environment for everyone. The pandemic has exacerbated the tension between academic achievement and mental health. As schools focus on curriculum catch up still to make up for the lost learning time, there's increased pressure on both students and staff. Many students who were already struggling with mental health issues found the disruption of lockdowns particularly difficult. In some cases, students reported that they preferred the quieter, less pressured environment of learning from home. Others, however, found the isolation challenging. Schools need to be mindful of these varying experiences as they design post pandemic recovery plans. It's crucial that mental health remains a priority and isn't sacrificed in the rush to catch up academically. In conclusion, the study highlights the importance of fostering a positive school culture to support student mental health. Schools that balance academic achievement with emotional and social development are more likely to create environments where students can thrive. There's also a need for further research to better understand how school culture and leadership influence mental health outcomes. As we continue to face the challenges posed by the pandemic and the rising mental health crisis, schools must prioritize well being alongside academic success. So, to wrap up, we're going to take a look at some discussion questions, and you can feel free to share your thoughts on how schools can better balance the need for academic achievement with mental health support and what role you think leadership plays in fostering a healthy school culture. We're also going to consider how schools can improve their ability to identify and address mental health issues early on. Then we're going to do a class exercise to practice some of these skills.